Pawel, thank you so much for being here today. We are going to be talking about what causes pain as we age and what we can do about it. And we're going to talk about how to find a good practitioner or therapist if we've got lingering problems that we're trying to address. And then at the end, I'm going to get you to give us some recommendations for a daily routine for somebody who wants to prevent and fix some of the pain that they're having as they get older, just using common tools like massage balls and stretching. So we've got a lot to cover. So jumping right in, why don't you tell us who you are, what you do, and tell us a bit about neuromuscular therapy.
Awesome. First of all, Melanie, thank you for having me. My name is Pawel Kotarba. My actual background is in sociology. So I have done my master's ages ago back in Poland, and since then I've been doing many different things, but most of them were related to working with people one-on-one, a lot of teaching climbing, teaching water skiing. And when I moved to New Zealand, none of my European qualifications are recognized here, so I started from the beginning and I chose manual therapy.
And how does a neuromuscular therapist, is that what you're called then? Is that your title?
That's the title of my bachelor's, yeah.
So how does that differ then, say if somebody goes and just goes to a spa and gets a massage, or if they come to see you, what's the main difference that they're going to experience?
Okay, so the main thing is that New Zealand is quite funny in this regard, because in here you don't have to have any qualifications to call yourself massage therapist, right? So when you go to spa, the best case scenario you'll find someone with level 4 certificate, and they know how to do so-called Swedish massage or effleurage, petrissage, really gentle stuff. It will be definitely beneficial if you need to release some stress. However, that won't be remedial or therapeutic massage. What we learn, it's a 3 years of anatomy, physiology, health psychology. So yeah, it's way more in depth. Like, to be honest, the bachelor's in manual therapy is very similar to what physios are studying. We learn the same strength tests, the same muscle length tests. The difference is that we then apply it and we actually touch the body as well.
And that's what I wanted to raise today, is the difference between somebody like you and just going to see somebody off the street because they're already at the spa you go to or something like that. Because when I found you, being a personal trainer and somebody that lives and breathes this stuff, I try to look for somebody who has more experience than me, who's going to teach me stuff. And I think that that's a big mistake that a lot of people make, is they don't really look at the bio or consider, what is the background of this person that I'm going to see. And so the reason I went to see you, for example, is because I was having shoulder problems, and I've seen physiotherapists and other people for my shoulder, and I've never really had any relief. And I saw your bio and I thought, okay, here's somebody who's hands-on, because I knew I needed somebody who's hands-on, but also somebody who has a climbing background, who's going to know shoulders, and you're over 40. And so I just wanted to make sure that people understand that today, to consider the whole person.
So you touched on quite a few things here. What I learned over the years of my own training, and basically every single book on training's got a chapter on injuries, and those chapters usually start with advice that if you really into your sport and you get injured, find a health professional who is also into sports. It doesn't have to be a person who does exactly the same discipline as you, but it will help if they do train, if they know their body, if they understand the emotional component, they understand the part of that you are almost addicted to what you do. You love it. It's a huge part of your life. They will approach you differently, because a lot of health professionals, unfortunately, will tell you to, if you're injured, just stop what caused the injury. And that's usually not the best advice. And you also mentioned age. I think that's quite important in a way, like, yes, you will get more experience with injuries, but I think in what we do, it's very important to have some life experience in how you approach your clients. So yeah, I choose my therapist exactly the same way.
Can you talk to us about what actually happens to tendons and ligaments as we age? Like, do they shorten? Do they get tighter? Like, what's happening as we get older? Why do we experience more aches and pains?
Okay, so the main thing about your tendons, ligaments, but also muscles and skin is that as we age, we lose collagen, which is main component of all of those. And as we lose collagen, tendons, ligaments, muscles, they get shortened and they get stiffer. And the easiest way to see it on your body is on your skin when you get wrinkles, right? Everything gets slightly shrank. With your joints as well, it's a synovial fluid which we lose as well. And synovial fluid makes your joints move nice and smooth. Nice and smooth. So these are the main things that happen in our body. With the muscles as well, we lose density, we lose mitochondria, so we lose our endurance and strength. So it's very complex, and it's many things happening in basically all parts of our body. So it's not just tendons, it's not just ligaments, it's everything.
And is there anything we can do about that? Like, in terms of, we're going to get more into what we can do about, like, in terms of self-massage and all that kind of stuff. But in terms of, for example, does taking collagen supplements help?
No research, really. I was taking a lot of collagen over my climbing career. So like over 15 years, I've never noticed much of a difference, to be honest. I don't know how well our body absorbs collagen from food and from supplements. If you believe advertising, yes, do it. But I'm not 100% sure. The main thing I strongly believe, and that's supported by research, is just keep moving. Never stop moving. We briefly talked about it before. One of the theories is that, yes, we lose this collagen and we get slightly fatter and we get less fit, and we blame age for it. But there is a question in that, like, do we actually lose all of that because of the fact that we gain years, or just because that with those years we change our lifestyle and we move less? And I would be leaning more towards the movement and lack of it.
So on that note, a lot of times and you've touched on this a little bit already, but I just really want to drive this home. A lot of times I will have somebody who is training and they might have experienced, maybe they're having some shoulder pain, for example, and they completely want to avoid training their shoulders, or even worse, they might want to completely avoid training their upper body. In my experience, this can make things a lot worse because of muscle loss and all of that. But oftentimes they'll get told, like you've said before, they might get told by another physical therapist or their doctor that they just need to stop what they're doing. And so I wanted to just get your advice on this. So in your experience, let's say I'm experiencing a shoulder impingement, which is what I actually came to see you for. Would you say don't train, or what would your advice be?
I would never say don't train. I would say, decrease the load. Maybe rest, have a rest a week, see how it feels. If after rest the pains go away, start training again. If pain doesn't go away, go and ask someone for some form of imagining, like do ultrasound, if you do MRI. A lot of things we just, like, even like palpation is really great tool, that's what we do. But there's a lot of things we cannot diagnose this way. So having image of what's actually happening inside the joint is really helpful. But like in your case, we didn't need to do it. We just need some movement, right? We need to release the tension, and that will be the first thing for me. Like, find someone who know what they're doing with their hands, and they can really help you very quickly. And also, the way I see my job, it's not just fixing you, because I'm not fixing anything really, but it's like bringing your awareness to certain things If you say you've got shoulder impingement, but then we have to start asking questions. Why? Where did it come from? What do you do on a daily basis? How do you sleep? How much do you sleep? How stressed you are? Is it actually shoulder impingement, or is it a pain which comes from somewhere else? It's a lot of question to ask and things to do before you decide, oh, I cannot do sports I love.
That's great advice. Now, I had another question that was a little bit selfish, but I use Kelly Starrett's virtual mobility coach. Now, Kelly Starrett is a really popular physical therapist on YouTube, and he's wrote books like Built to Move and The Supple Leopard. And I use it just to get some ideas for how to self-release trigger points at home. And he talks a lot about tissues becoming glued or stuck, and how we can use the massage balls and foam rollers and other tools to unglue or unstick. And these are just words that he uses, but I was really curious as to whether our tissues become glued in some way, and whether using the massage tools like a massage ball can help release them or make them glide or slide again, which is a lot of the terminology he uses.
Mm-hmm. So what I believe he's talking about is the muscle works. You have muscle fibers, right? And when your muscle contracts, those fibers go closer, and then when it releases, they get longer. But this is the place when they're the happiest, okay? What's happening when we overuse muscle? And like probably the best example is what we're doing right now. When you sit, your shoulders go forward, right? That's what we do all the time. Your pectoralis muscles get shortened. On the other hand, your back muscles, your rhomboids, especially the mid trapezius, they get lengthened, okay? And if we stay in this position for 8 hours a day, 5 days a week, those muscle fibers, they will get stuck in the position they shouldn't be stuck, right? So pectoralis in this particular case will get like that, but your back muscles will get like that. Now, what we believe is that if muscle fibers remain in this position, that really causes issue with blood getting into the tissue. So when you apply pressure, if it's massage gun, ball, you force blood to those spaces. And what happens then, with the fresh blood comes fresh oxygen. With fresh oxygen and blood comes all the other nutrients. And that will speed up the loosening up and most of all metabolical processes in the cell. And that should relax the muscle. So that's how it works. That's how we understand how it works at this stage.
The other thing I wanted to talk about today is the benefits of hanging, because that's something that you got me onto when I came to see you. So can you tell us about the benefits of hanging, and just so that people understand what we're talking about maybe at the end of a workout going and hanging from a bar a couple of times for 20 to 30 seconds.
So the main thing to understand the concept of hanging is to think about how we move on a daily basis. And what's happening, the first thing after we get out of bed in the morning, we start compressing our joints, right? We compress ankles, knees, hips, the whole spine compresses. We don't really do in our daily activities anything which would cause traction. So release the tension. I don't know, have you ever used the inversion table?
No, one of my partners used to use one though, quite regularly.
Mm-hmm. So basically, inversion table, that's the same concept as hanging, right? It's just slightly more comfortable because you don't have to use your muscles, but like you just hang upside down. And the whole idea is that it will release the vertebrae. They will just loosen up, right? I think hanging is even better because it doesn't only stretch the spine, but also opens up the shoulder, elbow, and wrist. I read more about hanging when I was reading a book about the guy who swam around England. And he mentioned in his book a research which says that because shoulder injury is very common among like long distance swimmers, climbers, tennis players, many different sport disciplines. And he mentioned the research which says that if you hang like 3 times a day for up to 30 seconds, that should prevent almost 90% of chance of the injury of the shoulder. I haven't read the research myself, but I do a lot of hanging, and I feel like it really helps. It just feels nice. I don't know, like when you go back home from my place and you just hang on the bar, how did that feel to you? Because for me, it just opens up everything.
It does. And to be honest, when I first started, I felt like I had more clearance between my feet and the floor. And now when I do it, I'm actually touching the floor. Like I can release myself and just stand on the floor. I don't have to try to use a stool or anything. So like it's almost making me taller.
Mm-hmm. Oh, definitely. Yeah, it would. It would, because there's a difference. I don't remember the numbers, but it's a difference between your, like, how tall you are in the morning and how tall you are in the evening after all day on your feet. There's significant difference.
And so if somebody's listening to this and they've never tried hanging before, how do they get started? Do you recommend they just go and just try to hang for 5 seconds, 10 seconds, or a couple of times every time they work out? Or
I would do that. Like, the beautiful thing about exercises like that, you cannot injure yourself. It can feel uncomfortable, but you won't hurt yourself. If you have a nice and big bar which wouldn't put too much stress on the joints of your fingers, that you can grab it properly, close hold, you won't injure yourself. Try with 5 seconds. Next time it might be 7, and you'll make the time up to 30 or even more. I have a client. She's in her late 40s. She's going up to 1 minute now, and when she started, she couldn't do more than 10 seconds.
Yeah, and I want to emphasize that because for me personally, I do pull-ups and I'm used to hanging from a bar a little bit. But when you told me to start doing it more deliberately, I actually found 10 seconds hard. And now, 30 seconds and I don't even really think about it. So you will be able to build up for sure. Now, on that, you mentioned wrists. And one thing I wanted to ask you about is a lot of people have wrist problems, especially women as they get older. And, is there anything we can do about that to strengthen our wrists or to help deal with some of the pain that we're experiencing, other than obviously setting up our workstations and stuff well, because that's where a lot of the pain is coming from?
That's probably what we should start with. But, when we talk about wrist and pain in the wrist, it's usually the tension between your wrist extensors and wrist flexors, right? So it's not just wrist, but all the research nowadays says that pain comes from weakness. So strengthening those muscles is the first thing you should do. And what I know from my climbing experience, but also now when I'm a body worker and I apply a lot of pressure and I put a lot of pressure on my wrists, there's a lot of tools that you can use to strengthen those muscles. There's like a little balls, like a very soft ball. Start with something very soft to squeeze. One of my favorite tools, you can make it at home. You just need a piece of stick, a little piece of rope, and really tiny weight. It can be a 1 liter water bottle, and you just try to put, you spin the cord, and you take the bottle up and take the bottle down. At the same time, you work both sides. It feels extremely easy to begin with because the weight is so small, almost insignificant. But after a few times, you will feel the pain. And again, it's one of those exercises because the resistance is so small, you cannot injure yourself. And I'm trying, when I talk to my client about exercise, that's what I'm trying to give them, like something that won't make things worse. And then, of course, on top of that, once you start strengthening, stretching, just put them in the position that you can feel the stretch and go opposite side. With stretching, always be gentle, very, very gentle. It quite often will feel uncomfortable, but you shouldn't feel any form of especially sharp pain. You don't want that.
What about elbows moving up the arm? Because elbows are a really big problem for people as they get older. So, what's going on with our elbows, and is there anything we can do about them?
It's the same thing. Elbow will be slightly more complicated in the way that you have those muscles below and above. So pain can be caused can go from your forearm, so muscles which attach to the elbow back from this side, but also can be caused by the pain going from the bicep or tricep. Again, strengthening everything around the elbow and shoulder, and stretching. It will take some time to describe all the possible stretches and all the possible causes. You have golfer's elbow, you have tennis elbow. That depends on which muscles are those which are tighter. So yeah.
And again, though, I think it's important that people don't stop training completely, because I think that's going to make the problem worse, right? Because everything's going to get weaker that supports the elbow. So, but again, a lot of people, they're afraid to train. So maybe it's just the advice you gave earlier, just back off the load and keep moving and keep building up that strength.
Never stop. I don't know if you have clients like that, but I experienced it myself, and I had a lot of clients who came to me after injury. They all of a sudden stopped doing their exercise because they couldn't. They injured their knee, and they started feeling their whole body aching, and it's just lack of movement. Like we're getting paranoid. Oh, I first I damaged my knee, and now my neck is sore and my lower back is sore, and it's just lack of movement most of the time, of course.
Yeah, and when I mentioned Kelly Start earlier, that physiotherapist on YouTube, that's one of his things as well. I have a very old little bit of an injury in my hamstring where it inserts into the glute, and a lot of people seem to have that, at least in my experience with the ladies coming in to see me. And he said, if you got that kind of thing going on, you don't need 10,000 steps, you need 15,000 steps. And it's amazing if I start to feel it and I just go for a long walk, how much it sorts it out.
Because if you don't put like very explosive power on it, you won't damage it by walking. You just won't. You will make it sore, but by the same token you will make it stronger.
Yeah. Well, this has been so fantastic. What I wanted to do before we sign off is get you to give us some advice for somebody who's, getting older, starting to feel the aches and pains, and wants to do something maybe on a daily basis. Say they got 10, 15 minutes a day. What's a good routine? What should they be prioritizing? Is it stretching after a workout, or is it doing some self-release on massage balls at the end of the day? Like, I suppose it's going to be different for everybody depending on what the problem is, but what are some of the main things that you recommend people do?
I think where I'm at the moment with my thinking about exercise, two main things are, for me, strengthening and mobility. I got to the point that now I think that stretching is a bit overrated. Like we need mobility. We don't need to be super flexible. And again, you have to keep in mind, what are you training for? If you want just to be able to walk, do your shopping, do your cleaning without pain, just mobility. And what I do, other than my regular training in the gym and running at the moment, is I start the day with like a body scan. It's kind of a technique from meditation. You just go from top to bottom. You do your neck, really gentle movements. You do your shoulders. I spend a lot of time just simply circling my hips. Flexion, so you bend forward, but also extension, you bend back. Side flexion. Very simple things like that won't take you more than 10 minutes, but you will feel way better. And I would recommend, and I do recommend it to my clients, to do it straight after waking up and then before going to bed. But also, if you work, especially if you work as a in front of the computer, as an office worker, have a frequent breaks and do exactly the same. You don't have to go through the whole body, but find this thing which actually are aching and just move them. We tend to have longer breaks for our lunch and then don't really have much of the other breaks. I would advise to have shorter breaks more frequently and spend them on moving.
That's fantastic advice. Hey, thank you so much for your time today. Now, in New Zealand, if people are lucky enough to live on the lower North Island, how do they find you?
Just go to our website. We are called Origin Manual Therapy. So website is omt.co.nz. If you're not lucky enough to be close to us, go to Massage New Zealand and you will find qualified therapists all over the country.
And for people who are in North America, is there something similar? Do you have any idea? Or should they just be Googling neuromuscular therapist in their area?
I have a lot of clients from States, and from what I've heard, massage therapy is quite well developed over there. Definitely Canada. A lot of the research we study here comes from Canada. It's a lot of like manual therapy is well developed, and it's perceived as a legit part of healthcare system. In Canada, you can find massage therapists in hospitals as a support team. So if you live in Northern America, you shouldn't have any issues finding therapists.
Okay, thank you so much for your time today, and we'll see you again soon.
Thank you very much for having me. It was a pleasure.